In Peru, the first cause of death for women is cervical cancer.
There are 500,000 new cases of cervical cancer each year. The highest incidence in South America is in Peru and Bolivia.
Peru has one of the highest rates of cervical cancer in the world, over 10 times as high as that as we see in the United States. When we work in Lima at the National Cancer Institute, I see 5 to 10 new women with cervical cancer every day that I'm there. And there's not a single medical center in the United States that sees that in a month. Cervical cancer is a disease that's 100% preventable.
And it's really a tragedy in our world that women anywhere continue to die from cervical cancer.
Most of the women from the very high portions of the Andes have no access to public transportation and walk 7 to 8 hours in order to get care.
Most individuals can't afford $2 for a pap smear.
Soy pobre, por eso he venido aquí a Pitumarca. Entonces las medicinas son carísimos, cuestan. Por eso estamos viniendo, como no tenemos plata, por eso hemos venido.
They don't have the money to be seen or being treated by the doctors, so they just go for many years before they ever get a Papa Nicolau done.
I would love to have people look into the face of a 40-year-old woman who presents to us who's never had a pap smear.
What we found today was that you do have a cancer there.
Who is at the end stage of the disease.
She needs treatment very soon.
Okay.
If she delays, it will kill her.
Who has 6 to 8 young children that she needs to take care of. And she's going to die of the disease within 5 to 10 years simply because she didn't have the means to get to a clinic. She didn't have the money, $1, to pay for a pap smear. And there's nothing we can do.
Just in a 3-year time frame, we've screened well over 10,000 women here.
Y más o menos ahorita tengo 150 más o menos repartidos.
So we can see all these women, that's no problem.
Ojalá que vengan más.
Si viene más, mejor. Si viene más. If they come, better, right?
We'll see. That's why we're here. We've performed over 100 surgical cases. We've done hundreds of diagnostic examinations.
I think they're becoming a little bit Peruvians because you don't have the means, you don't have the money, but still you reach your goals.
If you look at our performance, our efficiency, what we've already done here, we can continue that. We're a startup organization, but we're in here for the long haul.
We have a curable disease. If we had the financial means, we could vaccinate these children and no woman would ever have to die from this disease ever again. That's my goal for the rest of my professional life.